Throughout the years, crises associated with socioeconomic, political, or environmental factors have disproportionately affected the most vulnerable population. The global health emergency caused by the COVID-19 may have the same effects. According to the International Labour Organization, the economic and labor crisis associated with the pandemic could result in Latin America and the Caribbean in an increase of unemployment, which would cause the disappearance of the equivalent of 31 million full-time jobs, and an exponential increase in underemployment due to the reduction of labor hours and salaries. The measures of mandatory social isolation implemented in several countries of the region have restricted the movement of persons and merchandise and have annulled at the same time the buffer effect that self-employment usually has. In this context, the vulnerability of poor households could be aggravated, especially if the income provider has lost his or her job, has been infected, or has died. This, added to structural factors such as the foreseeable decrease in the gross domestic product in the countries, the increase in poverty, and the deepening of inequality aggravated by insufficient coverage of contributory and non-contributory programs, carry specific and differentiated risks for children and adolescents. It directly affects protective spaces such as schools, families, care centers, or services for the use of free time and provision of meals for children. It reduces the livelihoods of poor families, which can encourage them to push their sons and daughters into the labor market prematurely, especially into dangerous activities as a short-term survival strategy. It particularly exposes girls and teenagers to situations of abuse and violence because they are more exposed to carrying out intensive tasks of care at home or domestic work in the homes of third parties. These and other differentiated impacts of the crisis on children and adolescents should be among the priorities when designing and implementing public policy responses. The regional initiative Latin America and the Caribbean Free of Child Labor, made up of governments, employers, and workers' organizations, is committed to advancing towards the achievement of Target 8.7 of the Sustainable Development Goals, which calls for an end to child labor in all its forms by 2025. The challenge is even greater in the context of the crisis generated by COVID-19, which is why it is urgent, now more than ever, to put children and adolescents at the center and to preserve the region's progress in social justice, inclusion, and reduction of inequality. Please join us so that our children and adolescents are not left behind.